2 weeks, they come back for their initial 2-week checkup. At that point, you will take the patient's handheld unit, you will plug it into your workstation, and as soon as you plug it into your workstation, you will actually see the information showing that the patient has utilized their device. As this is a demonstration model, we will take this information here, I'm going to display it right here, and we will reviewing the InTone data. At this point, you'll notice that you'll have the session numbers listed, so it will show every session that the patient completed, the date on which they completed the session, the stimulation level that was set at the time of the initial visit, the baseline start pressure, and then you will see 2 rows of their initial short contraction, long contraction, stimulation contraction, and then again the last 2 rows are the last 5 minutes of biofeedback, their initial short contraction, and then their initial long contraction. What it does is it will show on a weekly basis that they completed their exercises. It will take the average of the pressures and show the measurable progression of the strengthening of the pelvic floor over time. Then on a weekly basis, on a week-over-week basis, it will show you the averages in PSI and show you that the pelvic floor has gotten stronger. As the pelvic floor gets stronger, the patient will report to you symptomatic improvement as well. When looking at this information, you always want to make sure that you are focusing on the start pressures. The start pressures are listed here in this row. We want to make sure that the start pressures are essentially the same. So if the patient pumps her device up to a 5, it will read 0.5. If the next day she pumps it up to a 10, it will read 1.0. The variation in pumping it up from a 5 to a 10 will skew the data so that we won't see measurable progression of the pelvic floor strengthening because we have not stabilized a baseline reading. So if the patient has pumped it up to a 5 one day and a 10 the next and a 7 the next and a 14 the next, the data will not look as it does here. In this particular case, the patient pumped their device up to their comfortably snug to the same level each day. Thus, when it averaged out all the pressures, it could measure the baseline pressures changing in a positive direction, showing that the pelvic floor has strengthened off of the baseline. At this point, if all of the data looks appropriate, the patient will insert their InTone device after they've put gel on it, pump it up to the comfortably snug. You will then click on Setup, put the hand controller in setup mode, disconnect it from your PC, plug it into the patient's device that has already been inserted, click the start button, and increase the stimulation to the appropriate level. Now, had the patient previously been at a 9 for their electrical stimulation, you will obviously increase it at least to a 10, sometimes to an 11 or a 12, depending on the patient's tolerability of the stimulation level. So in this case, we're going to increase it to an 11, so the patient feels the tingle and then they feel the tug. It's comfortable for them, so you unplug it, plug it back into your computer, and then click on Set Stim. We've now reprogrammed the patient's device after their 2 weeks to a higher stimulation level. At this point, the patient can go through their 12-minute session in office, since they're here, or should you so choose, you can have the patient go home and do it in the privacy of their own home. As the device needs to be charged every 2.5 weeks, you'll instruct the patient to go home, plug it into the wall outlet to charge their handheld unit so they won't have to charge it again for another 2.5 weeks. The patient will then subsequently come in 1 month from today's date for their next checkup. So a 2-week checkup, 6-week checkup, and 10-week checkup. At the 10-week mark, if they have stress incontinence, they should be able to indicate at least an 80% improvement in their reduction in leakage. If they have urge and mixed incontinence, they should still be able to report some reduction in episodes from their urgency or their frequency. So when the patient comes in for their initial setup, they're always going to have questions. The best way to handle all these questions is to introduce them to their InTone. You can hand them the device, show them how to pump it up, how to deflate it. They're going to ask about what is their appropriate level of pumping up the device. Can I overinflate it? Do I underinflate it? So on and so forth. You just want to make sure that they pump it up to their comfortably snug level. They're going to ask, does the stimulation, what does it feel like? You can tell them that it feels like a tingle and then a tug. It will not hurt the patient. You always want to make sure that the patient is aware that when they're actually utilizing their InTone, that they never take the device out in mid-use. If they do, it'll feel very uncomfortable because the stimulation will be delivered in a very uncomfortable area. You also want to make sure that the patient always makes sure that they insert the device at least halfway to the balloon, if not past this bump here. This is their orientation. If they're short of this bump and only have this in this far into the vagina, that's not going to work for your patient. At least halfway or farther. The patient will ask if there are any negative side effects. Some patients, especially elderly patients, postmenopausal patients that actually utilize the InTone device, initially in their first maybe week to 2 weeks, may experience some bleeding. The patient should not be concerned with this. It may happen, and after a couple weeks it will go away. It does not hurt the patient. It may just be a little inconvenient. When speaking with your patient, that you set realistic expectations for the InTone. This is not a miracle cure. They're not going to use it one time and be dry. There is a protocol that they need to follow. InTone recommends that the patient use the device once a day for 12 minutes, at least 6 days a week. If they miss one day, that's okay. I typically have them use it every single day, so they get onto a regimented schedule where they're using it once a day, every single day for 12 minutes. If at the 2-week mark, the patient does not see abatement in their stress, urge, or mixed incontinence, make sure that the patient is not discouraged. This takes time. It took time for their pelvic floor to get into the shape that it's in currently and experience the leakage that they're experiencing currently, and it will take time to get those symptoms back in check. So essentially, at the 2-week mark, while it's wonderful if patients do note some slight improvement, they may not see any at that point at all. At the 6-week mark, they typically can indicate some improvement, and some patients indicate measurable improvement, such as a 50% reduction in leakage. Every patient's different, and depending on their symptoms, it will take up to 12 weeks for a stress incontinent patient to become dry with the InTone, and it typically takes 26 weeks for an urge and mixed incontinent patient to have 80 to 100% reduction in their leakage. At the point where they have achieved their continence, they will then just utilize the InTone once or twice a week in the privacy of their own home for maintenance. We have now completed our InTone training video. For further information, you can visit our website at www.incontrolmedical.com, or you can contact your local sales professional for further training and support.